Hey, what's going on? It's Ian Hart here, and I'm pre-postnatal certified and also a back pain relief expert. And co-creator of Back Pain Relief for Life. So today what I'm going to take you through is back pain relief during pregnancy. This is something that's common. It comes about with most people in pregnancy that have a tendency to have a tight back, or they experience back pain. And here's the reason why. Lower extremity muscles, certain muscles tend to shorten or tighten and at the same time become overactive. And what overactive means is it's constantly being used more than the opposing muscle groups. So in reality, we're creating a muscular imbalance because of pregnancy. So the hip flexors, which are the muscles in the front of your hips, they attach from, say, where your quads are to where your pelvis is, get tight. Your spinal erectors, which are the muscles all the way up and down your spine, your lats, which attach to your pelvis, and then inside the arm, when they get tight, they turn your shoulder in. So if you think of the weight here having forward, it pulls your body forward. And then your piriformis. Piriformis is a smaller muscle behind the glutes, deep. I'm not even going to try to explain where it is right now, but they become overactive. Then you have the opposing muscle group that generally become long, weak, and tight. You have the abdominals. The abdominals, because they're moving while you expand, they become weak, and these are muscles that need to be kept active. Your glutes become weak as well. As you start to change that position, the glutes become inactive, plus people tend to be less active while they're pregnant, so the glutes aren't used as much, and then the hamstrings as well. So I go into this further in other videos that you can check out on back pain relief during pregnancy. But right today, what I want to show you is 2 exercises that can help you get relief right away. So those exercises are what we call a posterior pelvic tilt, because we want to combat those imbalances that are occurring. Posterior pelvic tilt, or what we call is a knee pull, and the glute medius activation, which is called a clam or a knee side dropout. So we're going to show you those videos. Okay, here we are. I'm about to show you a few movements that are going to help you relieve your back pain, put you in an anterior pelvic tilt, so tilt your pelvis so we're stretching tight muscles and strengthening weak muscles. The first movement is going to be the knee pull, but before you do the knee pull, I want to make sure you're in the proper position. So your head should be propped up with some type of pillow or ball, as you see that I'm using. Your hands are flat on the floor, feet are flat on the floor, knees bent, feet about 1 foot from your buttocks. And then you're going to start by pulling your knee into your chest. So you're tilting your pelvis, you're activating your abs, and then feeling a stretch in your lower back, and then kicking the leg forward, and then repeating the movement. So it's going to be 3 sets of 8 repetitions on each leg. So that would be, your right leg would be 8 reps, and then you switch and do the next leg, and right away I start to feel stress relieved off my back pain, or on my back I should say, right when I do these movements. So you feel stretching in the lower back, abs tight. So 3 sets, 8 repetitions. Alright, now the next one is going to be called a knee side dropout. And what this is going to be is pushing the leg out to the side, feeling a stretch on the inner thigh. Feel your glute medius activate, push out to the side, and then repeating 3 sets of 8. When you do this, keep your abs nice and tight, and keep your pelvis, your back flat, your pelvis tilted in neutral position, and then squeezing all the way out, and then open up all the way. So we're going to do 3 sets of 8 repetitions. I'll show you how it looks on the other side. And right away I feel this helps the back. Alright, so you just saw those 2 movements, the knee pull and the knee side dropout. Now those 2 movements right away will take stress off the lower back and actually help you activate your abdominals, which we said were weak. So When you do those two movements, what I want you to do is 3 sets of 8 repetitions. So do your left leg for 8 reps, do your right leg 8 reps, and then repeat 2 more times, which would be a total of 3 sets. Then do the clams, 3 sets of 8 repetitions. And if you would like to further a program that would tremendously help back pain during pregnancy, what I'd like you to do is go ahead and click the link below. We have a program, it's 8 exercises. Not only is it going to help your back pain, but it will help your hips as your body and your anatomy starts to change during pregnancy. So the link is below at backpainreliefforlife.com, and you can decide if it's for you. We have a bunch of testimonials of people who have tremendous relief. So go ahead and click that link, check and see if that program would be good for you. And again, this is Ian Hart, co-creator of Back Pain Relief for Life and pre-postnatal certified coach.